Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. And joining us today are CAHOOTS Coordinator Tim Black, Eugene Mayor Lucy Vinis, and Eugene Police Chief Chris Skinner might be able to join as well. Please note that all participants have been muted. In order to submit a question for the mayor or for our guests, please use the chat feature. All of our town halls are recorded and are available on the city's website and also on the YouTube page. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and thank you to all of you who are joining us today. I know this is the beginning of the holiday weekend. Not that I want you to go anywhere where there are crowds of people, but we appreciate you taking the time to join us because this is a really important topic. A different model of policing can look like. It's something that's certainly been very top of mind for us in Alameda in the last not even 2 months. But before I introduce our awesome guests, I just want to talk a little bit about the COVID crisis that we are in, and let you know that the shelter-in-place orders still exist. You're still required to wear masks whenever you leave your home. I know I've gotten a lot of emails about why are you keeping the beach open for the Oregonians? We are an island and we have a lovely beach, but so the beach opening or closing decision lies in the hands of East Bay Regional Parks District. I will let you know that late last night I was emailing with Ellen Corbett, who is our representative on she represents the part of the East Bay Regional Parks District that includes Crown Beach and Crab Cove. And actually what I did is, one of you, I don't know if you're out there, but a constituent wrote such a compelling letter. And I mean, I've been advocating for closing the beach for a while and have not won the day. But this constituent's letter was so compelling, her email, I just forwarded it to Ellen Corbett and the general manager of the Regional Parks District and our city manager to keep him in the loop. And so Ellen emailed back and said that the Park District is discussing this further today. So Sarah, if at any time you get an alert that says, yes, they're following the mayor's, please just cut in and tell us about that. But in the meantime, I would really strongly suggest any Alameda residents, don't go to the beach this weekend. It will just be crowded. If it is open, it'll be crowded. We're at a time in California, in our county, where we're seeing our COVID rates rise alarmingly. You need to protect yourself and protect others. So enjoy yourselves outdoors 6 feet from other people and wearing a mask, please. And but you know, one thing I do want to give a shout out to one of our a local resident and also an owner of a business, Alan Michon. I don't know if you're listening, Alan, but you are my hero because he runs, it's a fabulous event called Antiques by the Bay. It's a once a month, the first Sunday of the month, like open air. It's amazing. Mayor Vinis, Mr. Black, if you're ever down here, it's great events, but it attracts thousands of people. Well, in the last couple of weeks, he applied for and got permission from the county to reopen starting this Sunday. But then all of a sudden, COVID rates went up, and we asked County Public Health, are you sure this is a good idea? And they said, oh, the criteria are all there. I'm not throwing County Public Health under the bus. They've done a masterful job, but they would have given him the green light. But yesterday, of his own accord, Alan Michon said, I can't do this. I cannot put my vendors, even though they're suffering financially, as are all merchants. I can't put my vendors. I can't put the public who would come and and shop there. I can't put them at risk. And so, as painful as it is, he made that decision, and I'm very grateful for him. This is not a good time to have thousands of people coming to your city for an event. So anyway, all the best to Alan Michon. Thank you. Without further ado, I want to introduce our speakers today, and I'm so grateful to them for joining us because those of you who have been following events in the city and listening to our council meetings and special meetings know that there is a very well-regarded model of alternative police response. So as I think we're all coming to understand better and better, there are many calls that police are sent to that really are not best served by a uniformed officer carrying a weapon. They just aren't. And we've seen an example here. I briefed Mayor Vinis about our incident, the unfortunate dancing while black arrest that happened in May. But as I was telling the mayor yesterday, we met by phone yesterday. I have been listening to and reading everything I can get my hands on about better ways to do policing, as have all my colleagues on the city council, I think, and listening from our community to our community. But I heard such a great story about this CAHOOTS program, which stands for Crisis Assistance Helping Out on the Streets. I heard an interview on NPR, and I was just intrigued. So I reached out. I was able to talk to Tim Black, who is the coordinator of the program. And I know our police chief has reached out to someone in the Eugene Police Department to understand the mechanisms, and actually I think he got the agreement to see what that looks like. And we might even be joined by phone by Eugene's police chief. But I have here with me Mayor Lucy Vinis of Eugene, Oregon, and Mr. Tim Black, the coordinator of the CAHOOTS program. I will tell you that Eugene, Oregon is a big city in Oregon. It is 178,000 residents, and then with its neighbor Springfield, which is also a part of this White Bird Clinic and CAHOOTS program you'll hear about. That's a metropolitan area of about, I think you said 250,000, is that right, Mayor? And so Mayor Vinis is the mayor, independently, separately elected, as am I, but then she has a council of 8 members in Eugene, and each of her council members represents a different, I think you call it wards.
Correct.
So a particular geographic area of the city. They're also the home of the University of Oregon, go Ducks. And, but this Whitebird Clinic and the CAHOOTS program is over 30 years old. So I am going to turn the floor over to both Mayor Vinis and Tim Black. And why don't you two, you can just go back and forth, tell us about the program, how it serves the community, the advantages, the benefits, the challenges, what it looks like today, what it might look like in the future. I am going to turn the floor over to both of you, and you can just decide who goes when. And with that, thank you again so much for taking time out of your day to join me and my Alameda residents. I know if we were in a room, they would all give you a hearty round of applause. So with that, please, Oregonians, the floor is yours.
Sure. Thanks, Mayor Ashcraft. I suppose I could start with just a little bit of history lesson on, where CAHOOTS came from and what Whitebird Clinic is. That tends to just kind of give us all a really good foundation to work from there. And then Mayor Vinis can help me talk about what's going on now in our community. Whitebird Clinic started in the winter of 1969, 1970, when our community here in Eugene, being a more liberal college town, started to experience a lot of the same issues that were happening in the Bay Area, kind of the shadow of the summer of love, right? The influx of young people from the East Coast, bringing with them, rates of mental illness, substance use and abuse, and a profound need for housing. Our founders of the clinic really wanted to try and find a way to respond to that level of need in a way that wasn't already happening in our community. And so we came down to your neck of the woods. Our founders came down and spent a couple of months living with and working, living with the volunteers and working at the Haight-Ashbury Free Clinic.
Oh my
goodness. And it was that model of alternative service provision that really inspired our founders to come back up to Eugene and start what we called the Whitebird Socio-Medical Aid Station. The very first things that we offered were really similar to the Haight-Ashbury Free Clinic, as a place to go when you're having a rough time, maybe because you didn't feel like you had a sense of community anywhere else in our town. And as we responded to those needs organically, what we really saw was this dramatic demand for crisis response that looked different. And so we had a phone that started ringing as a crisis hotline that went to our founder's living room before we had a brick and mortar location. And that's the same phone number that people are still calling today, 50 years later. It's that same phone number ringing. we started to find ways to maintain a therapeutic space when we did get a brick and mortar location. And that really became our bread and butter. We had doctors and nurses, psychiatrists, counselors that would come and work with us, and we could do, some mental health services, some medical things, but it was really that crisis response and that ability to provide something grassroots that was different, that was our strength as an agency. As that phone line was ringing and as people were coming into our clinic, we started to see more and more need for us to be able to go out to folks, to engage with them in their environments, because that was what was informing the crisis, either because they couldn't make it to a payphone, or, somebody was really worried about their neighbor and just wished somebody could go knock on the door and, find out what was going on. And so, at Whitebird Clinic, we kind of affectionately refer to those as bummer situations. Somebody's having enough of a bummer that they need someone to come to them. So we activated what we called the Bummer Squad. And the Bummer Squad would go out in personal vehicles with a first aid kit, and we would go and talk to people where they were. And we started to build trust in the community to actually come into their homes, to meet them in their camps, to talk with them. And we had a really strong partnership from the city of Eugene in being a place, as a brick and mortar location where folks could come instead of the hospital, where officers could bring people in crisis rather than taking them to jail. And it just felt so natural to really take that Bummer Squad, mobile response, utilize city resources and infrastructure, and formalize this thing and build on that trust that we had, build on that relationship that we had with, the city of Eugene to develop what became the CAHOOTS program. And then our first official CAHOOTS shift was on July 4th, 1989. So tomorrow's our birthday.
Wow.
So it's exciting that we get to celebrate that birthday with you all today.
Yeah, happy birthday.
Thank you. Yeah. And so for 31 years, we've just continued to really build and grow this program. And now we have not just 24/7 coverage in Eugene, and a lot of that has been, with the help of Mayor Vinis, to really make sure that our services have been able to grow at a manageable rate, and that we have other resources in our community to take folks to. But we now also serve the community of Springfield, which is just across the river from Eugene and makes up the rest of our metro area. So, I mean, that's 31 years of, CAHOOTS and 50 years of Whitebird Clinic in probably 5 minutes. But that's how we got to where we are today.
That's an amazing story. I didn't know all of that. Mayor Vinis, what would you add to that before I pepper you both with a few questions? And then the audience will want to ask questions too.
Right.
Yeah.
Now, I'm just going to add to this. Was a wonderful short history, Tim. Thank you so much. I think, we have found this to be an invaluable resource, and we are in a current situation in which it really, in response to Black Lives Matter, in response to racial justice concerns, that, a groundswell of support for an expansion of our relationship with CAHOOTS. And so your call to us is timely. I think that you're recognizing that this is a much more appropriate kind of response to so many of the people in our community, whether they're housed or unhoused, who need a kind of a wellness check or a way to access services in a mental health crisis or an addiction crisis. So we have found it incredibly valuable, and we're really beginning that discussion about how do we strengthen and deepen that relationship with CAHOOTS, because it's such an important service.
So at the council level, you're starting to have that discussion, are you?
Yeah, so we're the city council a year ago adopted what we call the Community Safety Initiative. We did a several-year study of our whole public safety network system. What was working, what wasn't working. We had a transition from a chief who retired. We had an interim chief who kind of did that broad assessment of the strengths, the weaknesses, what was needed in our department. We're a community that had grown very quickly, but we hadn't grown our police department. So we've been understaffed in the police department for a long time. But we'd also implemented, in addition to our relationship with CAHOOTS, we'd implemented some other aspects of our public safety system. So we have a community court that we'd established about 4 years ago.
Yeah.
And the community court is designed to divert people who are have minor offenses often associated with their condition of homelessness, so often trespassing. Divert them from the criminal justice system and into a community system in which their situation is really adjudicated by our municipal court judge, and it's in the main floor of our library. It's on Friday mornings, and people can either walk in or they can be referred. And then our service providers are in the next room. So after they meet with the judge and talk about what they need, then they begin that process of accessing services. So that is kind of a new piece. We instituted a couple of years ago a 15th night program, which was designed to help youth who were either had fallen into homelessness already or were at risk of falling into homelessness, to try and provide a network around them of supports to reconnect them to support systems, reconnect them to family or whatever they need, with the understanding that if a youth is on the streets for 15 days, after 15 days, it's just going to be much harder for them. They're much more vulnerable, the increasing trauma, the increasing alienation. So we have a number of things. They're all wrapped up in that community safety initiative. And so now, as a result of the current pressure around the public demanding, right, that we rethink how we use our police forces, what the priorities are, and huge support for investing more in CAHOOTS. Our city council later this month, is going to take a look again at that community safety initiative and look about, are there ways in which we want to adjust? The lion's share of the money is going for police officers because we have been understaffed in our police department. But so there's a question of, is there a different way that we want to juggle those funds? What do we have to do? And are there other pieces that we might want to bring into play?
So is the funding for the CAHOOTS program, does that come out of the police department's budget?
It comes out of the police department's budget, exactly.
Okay. Do you know what percentage of the police department's budget the CAHOOTS funding currently represents?
Well, you can do the math for me, but the police department's budget is just under $60 million, and the CAHOOTS budget is $780,000.
Oh.
With the last funding increase that we got, we're closer to around 900,000. Right?
900,000. Okay, there we go.
Okay. Yeah. Okay. And then thanks, Mayor Vinis. That was helpful. So Mr. Black, there's two funding streams, it seems like, because you operate out of the Whitebird Clinic, the program. By the way, tell people who are watching, I commented on your nice polo shirt. Tell us a little bit about what you're wearing.
Yeah, so I am wearing the shirt. It's got the CAHOOTS and Whitebird Clinic logo on it. And I joke, this is the Class A uniform for for CAHOOTS staff, and that's because most of the time when we're out in the field talking to folks, we're wearing jeans and a t-shirt. We recognize part of the value in our service is that we don't look like officers or firefighters. We look like somebody that you might, want to talk to when you're having a bad day. And so, Whitebird Clinic does have a strong counterculture past, and that does still inform some of our dress code at work. But yeah, today I wanted to just kind of dress up a little bit and, kind of
dress up in a polo. Good.
Yeah, exactly. Yeah.
And you mentioned the team that would go out, that someone who was having a bummer day would encounter. What would tell us about what a team would look like or will be comprised of?
Yeah, so anytime that you see if you all come up to Eugene or Springfield, and I hope that you do come visit. I love coming down to the Bay, and there's a lot to do up here too. But whenever you do see that CAHOOTS team driving around, in the van, you're gonna notice there's two folks, right? There's somebody driving, somebody riding. That two-person team is what makes our CAHOOTS response so incredible, because one of those folks is a medic. The other person is a crisis worker. And that means that we can handle not just a lot of behavioral health calls that come in, but all sorts of non-emergency medical situations, first aid, chronic medical response. And what that helps us do is engage in harm reduction conversations. So if somebody's got a medical issue that's related to substance use, maybe they're an intravenous drug user, and they've been injecting and they've gotten an abscess, we can talk with them about effective wound care while you're out on the streets. And then we can also, maybe do a referral to treatment, or even just kind of talk about other things that they do that they can, to keep themselves a little bit safer, maybe they need some help connecting to a physician that is going to respond in a compassionate way because they weren't treated well the last time they went to, one of the other clinics. And so, how do you access healthcare, when you are unhoused? These things that don't seem like barriers to you and me can be really almost impossible hurdles. And so when
Absolutely.
we can have that medic and crisis worker respond to the calls together, for one, there's safety in having that two-person team respond. But if I come from a background where I was discouraged from talking about my feelings my whole life, and I've been having a hard time for the last couple of years, maybe I'm not going to be able to reach out to somebody and say, hey, I've been feeling depressed and anxious and I don't know what to do. But I can call and say, hey, can I have the CAHOOTS medic come and talk to me? I have a stomach ache and I notice that I haven't been able to eat lately. And then when they come out, it's that medic and the crisis worker. The medic's taking my vitals. The crisis worker is going to check in with me. What's been going on lately? What have you been up to? And find out, oh, I lost my job a year ago. And that's when I started to have the stomach ache. Tell me about your family. Well, my uncle was hospitalized a lot at the state hospital in Salem when I was growing up. And, my grandma died of suicide. And then we start to, kind of get some understanding of what's going on. And we're not going to rush that person into really talking about specifically, I'm experiencing, behavioral health issues, but we can open the door to really talk about it. And if that person feels like the only way they can reach out to CAHOOTS is by starting the conversation about that stomach ache, then great. Please call us about your stomach ache every time. And on the other side, we will have calls where we go out to talk to somebody, they're having a real hard time. They're very open about their experiences with mental health. And they had a medication change and they're just feeling totally off since they switched that medication. Our crisis workers talking with them about all of the, emotional impacts of that. But then our medic is there to really discuss, these are the side effects that you're feeling, either because you're weaning off of, this one medication, or, you're adjusting to the new dosage of this other medication. And so we've just found that having that medic and crisis worker together means that we get to treat each individual as a whole person.
Wow. And you yourself are a former crisis worker for
That's correct.
CAHOOTS, right? That's how you joined the program.
Yeah.
Um, the calls that come into CAHOOTS, so you mentioned that it was the same phone number. Is that for the clinic? Because don't the calls come through 911,
Yeah.
Mayor Vinis, maybe, or whoever wants to take that one?
Yeah, all of the calls for service for CAHOOTS are coming through the Public Safety Dispatch Center. So we're
Okay.
using the same dispatchers as police and fire in our community. Whitebird Clinic has a crisis line. That's a 24/7 crisis line. So for folks
Okay.
that are feeling like the best way that they can reach out is by voice or by text, they have that resource through our crisis line. And that facility also offers some walk-in crisis services. So our folks are able to, really respond in that brick and mortar location for people who really just want to get out of their environment, go into a nice kind of quiet room with some plants and a fan and talk to somebody, or they can call in on the phone and talk to a crisis worker that way. And then there's, accessing CAHOOTS through dispatch.
And then are the dispatchers specially trained? Because how would they know which calls to hand off to CAHOOTS and which calls to hand off to an officer?
Yeah, so we are relying on, folks who are trained to be 911 dispatchers.
Right.
And within the, dispatch system in Eugene, those folks need to be able to work the console for, police and CAHOOTS or the fire department. And so there's a lot of crossover and, cross training that goes on. And this is actually one area where, as Mayor Vinis mentioned, we have experienced a lot of, I don't know, pressure or energy from our community around some things that, CAHOOTS still needs to do to improve what we're doing, to make ourselves more accessible. And one of those is that right now you do still have to call the police non-emergency line to access CAHOOTS. And for many folks in our community, that presents a barrier because essentially what we're
Yeah.
asking people to do is call the police on themselves when they're in crisis. And
Hmm.
so, I was hoping that Chief Skinner could join us today too, but both Chief Skinner and Mayor Vinis have expressed support around us really looking at what would it take for CAHOOTS to have its own phone number that is answered by a dispatcher, yes, in the public
Hmm.
safety system, but that dispatcher isn't going to be saying, police, fire, CAHOOTS. They're going to be saying, you've reached the CAHOOTS dispatch, and at that point, do we have an opportunity to really engage in even more training? every dispatcher that we work with is amazing. We have just the most incredible 911 system, in our community. And, we've been really lucky to work with the city of Eugene to develop a contract that really spells out all the different things that CAHOOTS does in a way that has made it very efficient and really seamless for dispatch to say, hey, oh, there's a CAHOOTS call, or this one came in. Yep, they wanted police, but they need CAHOOTS. And so we'll send CAHOOTS. And then, fire department goes out on something and they say, hey, we would really love it if CAHOOTS could help this person, because that seems like the most appropriate resource. And then that dispatcher can just, bug the person at the next cubicle and say, hey, get the CAHOOTS team to go over to that call. So it's this really dynamic and collaborative process that's allowed us to be so responsive and to serve our community in such a profound way.
And I've read the statistic, and I can't remember the exact numbers, but there are some times on some calls when the CAHOOTS workers decide, they might get to a scene and decide, no, we do need an officer. Do you have either of you offhand? It was out of a large number of calls, it was a pretty small percentage.
So we had 24,000 calls for service last calendar year. And
Okay.
in that same period of time, we had less than 150 Code 3 cover requests. And so what Code 3 cover request means is that there were less than 150 situations in Eugene and Springfield combined where we arrived on scene and a situation was escalated, too messy, and we needed, police to come, lights and sirens to get there. So that comes out to, let's, round figures, 150 calls out of 24,000 comes out to 0.6% of our calls that are so escalated that we need law enforcement to assist us in managing the scene.
Wow, that's amazing. Let's see. Mayor Vinis, anything you wanted to add about, the police, so your police budget comes out of your general fund, correct?
Right.
And would I be safe in assuming that Eugene, like every other city I know of, is looking at some budget shortfall with the COVID crisis?
Yes, and actually, when I cited the police budget as just under $60,000, that's already taking a cut. It was originally higher than that.
I think it was 60 million, probably not thousand.
I'm
right?
sorry,
Yeah,
60
yeah.
million. Yes, excuse me. Yeah, that would
We
be cheap.
wish, yeah.
That would be a small police department.
Yeah.
Yeah, so it's already taken that an essential hit in beginning FY21, which started on July 1st.
Yeah.
We also, I mentioned this community safety initiative. And so when we did that work, one of the conclusions was we actually needed more police officers. And in addition, we needed more investment in our 911 system and in our municipal court and various other pieces. And so we actually had a subcommittee that did a review study of how will we pay for that expanded services, because there isn't money in our general fund. Yeah. And so the council adopted what we call the community safety payroll tax. So we instituted a payroll tax. We haven't started receiving those funds. It will start in January 21.
Okay.
That tax, now this was the concept behind the tax, is that it would be very broad and very shallow. So employees and employers in the city of Eugene pay it. We exempted minimum wage employers, and we reduced the rate for employees, and we reduced the rate for employees that earn between $12 and $15 an hour. We're taxed at a lower rate. But the idea was that many people would pay into it so that no one would have to pay very much into it. Under the premise that public safety is something that everyone benefits from. Everybody needs it, everyone benefits from it. And so in the full economy, before COVID hit and before this economic crisis, we were budgeting for $23.9 million additional dollars for our safety system.
Wow.
It was going to give us the capacity to have a much more robust response on multiple levels. Now that's still in play. We still expect to be collecting that tax. Certainly you're not going to expect to collect that much because, right, a lot of businesses aren't functioning at that level. We're worried about how many businesses will close. But we have, this longstanding commitment of recognizing that our overall community safety system is inadequate. And so now we're facing this all right, how do we get the most appropriate response for the funds we have? We did this study on the Community Safety Initiative. We still have that. How much do we need to adjust that to meet these immediate circumstances? And the one piece that I'll add, and you and I talked about this yesterday, is that we have a steadily expanding crisis with homelessness here. And
as do we, yeah.
So CAHOOTS is at the sort of rescue end of that, responding to people that are already out there. And the question, we confront is, as a community, how do we invest a little more in the upstream cost, right? How do we do some homelessness prevention work? How do we support public health? How do we do some other work so we don't have so many people kind of falling into this system? And we've done a lot of work around that. And I think this double crisis of homelessness and pandemic, well, triple crisis, homelessness, pandemic, and racial justice, police reform.
Absolutely. Yeah.
All bring those things very much into focus. I think that is really what's on our city government, and yours too. That's what's on our plate right now. How do we make sure we're putting resources in the right place?
I couldn't agree more. We just met yesterday on the phone, but we focus on the crisis before us, but we can't lose sight of the fact that there were ongoing crises that need to be addressed. And we are going to keep in touch because I want to pick your brain about some resources. So now I will say, I know I've heard from Sarah, our public information officer, that we have some questions coming in from the public. So let's hear what the public would like to ask you. And again, thank you both so much. This is fascinating and very, very helpful to me. So Sarah, start us off.
Yep, this is great. And I have a bunch of questions, but I also have a bunch of people just saying how amazing the program is. So no questions there, but just lots of kudos.
Aren't we fortunate to have them join us today? I am
Absolutely.
so grateful.
The first question, kind of stemming off of the conversation that we were just having, Eugene and the CAHOOTS program are centered in a majority white community. What specific program components address systemic racism and implicit bias? And how could a program here in Alameda learn from CAHOOTS and build a more anti-racist program?
And I'm just going to, before Tim, whoever wants to start the questioning, I'll say, that's an excellent question, and Mayor Vinis and I talked about our different demographics. I will also let you know that these people, I don't know when they do their job because everybody wants to hear from Eugene, Oregon, and CAHOOTS. And Mayor Vinis has been in communication with my friend and neighboring mayor, Mayor Libby Schaff of Oakland next door. And I know, I believe Mr. Black's been in contact with members of the Oakland Police Department because they also want to do a similar program scaled to Oakland. And so they, yes, whoever wants to, or both of you, whoever wants to tackle that question, I'm all ears.
Yeah, I think I can speak to kind of internal to CAHOOTS, how we can address that question. For a long time, we just kind of took it for granted that by having this alternative response within our public safety system, that we are accomplishing leaps and bounds and addressing racial injustice in our community. But as I mentioned earlier, it's only been more recently that we've really been forced to recognize that our point of access was in itself, a barrier to many. Many folks, many different communities of color who didn't feel like they could reach out to the police when they're in those moments of crisis. And so what we're doing right now is not problem solving. We've really found ourselves in a position where we need to learn, we need to listen. And to that extent, we've engaged with local, members of the Black Lives Matter movement to receive a lot of training, to really spend time talking about equity, learning about implicit and explicit bias, really going into a deep dive on our program around where is it that white privilege is rearing its head. What are the things that we are doing subconsciously that are reinforcing oppressive practices elsewhere in our community. We need to really listen. We need to learn before we can do better. And part of that also means building better relationships. And so right now, Whitebird Clinic and CAHOOTS are trying to actively build a stewardship council that is primarily, chaired by folks from BIPOC communities that we want to serve better. We need to hear from them, and we need to hear from them on an ongoing basis if we're going to be able to continue to provide a program that's responsive to our community's needs. One of those places is that, point of access. And so as Mayor Vinis mentioned, part of that real assessment of the 911 system is how could CAHOOTS as a behavioral health first response resource be pulled out of that kind of back pocket of the police department and stood up as its own entity within the public safety infrastructure. And so, there's some very immediate things that we can do, like in the existing non-emergency phone tree, adding a specific option to reach out to CAHOOTS, and then having that call taker know that because this person has requested CAHOOTS by pressing 3, that they need to answer the phone, public safety CAHOOTS response. Beyond that, we're still learning, what else we need to do to improve our services.
And what did you tell me that there was a council or something you called that you're building new relationships, and there you formed what was the
we
name?
call it a stewardship council.
Stewardship council.
Yeah, and then there's also, and that's really important for any sort of program that's really going to go out and try to serve, any community. There need to be really deliberate and consistent avenues for consumer voices and community voices to be heard, so that those services, just like we're trying to do with CAHOOTS, but any service can really stay in a position of being responsive and trauma informed.
And Mayor Vinis, what would you add to that?
Yeah, I would add to that I think that what we're recognizing, which we've known for a long time, but it's of course at a peak level of urgency, acute for all of us, is the lack of trust, right? That there is not trust in our police department, and actually there's not trust in government as a whole to do the right thing and to defend people the way they need to. And I think we've fixed a lot of things along the way in our police department. We instituted an independent police auditor to investigate police behavior. He is joined by a civilian review board to review those cases. We have a police commission that works on policies. But so I think what we're recognizing in this outpouring of demand for more support for CAHOOTS is that CAHOOTS is trusted. They are trusted by this population that is deeply triggered and not wanting to confront a police officer and not wanting to be in the police system, even if they need help. And that is, so recognizing that we need to make the most of that trusted relationship in how we respond, but we also need to fix our own system so that we are more trusted. And so I think that's the hard work ahead of us. We roll out initially working on policies, but every episode, as you well know, everything that happens that doesn't go well, and we had a terrible incident on Sunday night with a leader of a protest movement getting struck by a car, and it has just deepened the sense of distrust and the lack of faith in the system that we'll really investigate fairly, that the driver will be held to account. I mean, it just brought right up in front of us all of the tensions and frustrations that people carry. So both things, we're incredibly grateful to have CAHOOTS there because they are trusted, and we are at a point of recognizing we have a huge amount of work to do in order to build more faith and confidence in our own services, not just police, but all of our services.
Yeah, no, I agree with you completely there. I know we've got a bunch of questions coming in, right, Sarah? So
Yep.
We'll move through these as quickly as we can. What have you got?
This one's for Mr. Black. What types of credentials or backgrounds are required for workers in the program?
That's a great question.
It is a great question. Thank you.
Yeah. So for our medics, we need to have folks who are certified in the state of Oregon as at least an EMT basic. We do have some paramedics and even a couple of RNs that work for our program, but everything that CAHOOTS does on the medical side falls under the BLS, or basic life support scope. We do Narcan, and we carry EpiPens, and we can do things for diabetic emergencies. But if somebody needs more than that, then they likely need, an EMS response instead of CAHOOTS.
Yeah.
On the crisis worker side, we're not doing diagnostics out in the field. We're not prescribing. We're also not doing 5150s or, the Oregon equivalent. And so our crisis workers need to have a combination of education and experience that will allow them to be successful in the work. We don't need to have a master's level clinician. We do have a few that work for us, just like the RNs. They're really helpful when it comes to clinical supervision and training of our new staff. But what we're looking for is really kind of the base standard is the ability to meet what in Oregon we call, a QMHA, or Qualified Mental Health Associate credentialing. And for instance, my background is, I didn't go to school for psychology. I'm an English major. I'm a BFA, but I found out that I was decent at talking to people, and so I spent a lot of time working at a couple of nonprofits here in Eugene, Northwest Youth Corps, and then Looking Glass Youth Services, where I really learned how to be a crisis worker and learned about how to engage with unhoused populations and, engage in harm reduction conversations. And it was that ability to gain that skill set and then come to work on CAHOOTS that allowed me to be successful as a crisis worker.
And then does CAHOOTS train, do you provide training for your workers before they go out on a team?
Absolutely. A lot of training. So, regardless of that background, you get through the hiring process and we're like, hey, awesome, welcome to the CAHOOTS team. You've still got about 500 hours of field training and 30 to 40 hours of class time ahead of you before you're a part of that 2-person team taking dispatch responses.
Great. Yeah. Well, we'll be in touch. Sarah, what else? I know.
Well, following up on that, somebody asked if somebody does need a 5150, does the police still need to be called, or do they transport someone to a specific facility?
Mm-hmm. So if somebody does need a psychiatric hold, the route that the CAHOOTS program utilizes, because we are completely voluntary, is that we do have to engage patrol at that point. What that looks like.
When you say, sorry to interrupt, but when you say completely voluntary, so you are relying on the individual who you've encountered or who's called you to be willing to go with you or
Absolutely.
to, yeah.
Yeah, and as Mayor Vinis mentioned, we have a lot of trust from our community, and so by and large, when folks are in those really acute moments of profound crisis, where we do need other resources like the hospital to help keep them safe, generally we have really good experiences, kind of talking with people, articulating the severity of the situation. But in those rare circumstances where we do need to get a hold on somebody because they need to get to that higher level of care and aren't able to make that voluntary decision to go with us, we are calling the police. What happens though is we don't leave the scene. We don't say, all right, well, the cops are going to come talk to you. We're bugging out. Chances are we've put 2 or 3 hours into that conversation at that point. We've got some investment in you and your safety, because we're still there. When that officer is called in, that officer is going to talk to the CAHOOTS team before they engage with the patient. So we still are keeping that kind of layer of insulation there, right? And it's not that we're asking that individual to then go through that 3-hour dialogue with that patrol officer before the patrol officer makes up their mind. We get to present everything that we've experienced, everything that we've seen, talked about, everything that we've tried, and then really work together to say like, hey, this person still needs that higher level of care. And just because the officer's on scene doesn't mean that it's going to be involuntary. For lack of a better term, sometimes we have what's called the CAHOOTS or cuffs conversation with somebody.
What is it called?
CAHOOTS
or cuffs?
CAHOOTS or cuffs, because there is something about this situation that means that it is unsafe for us to leave you in that environment, either because of what you're experiencing and what you're at risk of doing to yourself or to others. And so we got to get you to the hospital. This officer is here, because of the severity, but you still have the choice for this to be a voluntary transport. You still have the choice as the expert in your situation to make the determination about how you access that higher level of care. And so there are plenty of times where officer shows up, we all have a conversation, and that individual decides, I'm going to go with CAHOOTS and make this my decision to go. We get that opportunity to really empower people about with how they access treatment. But worst case scenario, that person does need to go in the back of a patrol car in handcuffs through the back door of the hospital. The CAHOOTS team's still going to go, and we're going to do our transfer of care because we still perceive there to be value in all the things that we tried that weren't successful before that officer showed up. And that patient deserves for their crisis worker at the hospital to have that context before they come in for that evaluation.
So the CAHOOTS team would then go on to the hospital and meet
Absolutely.
the patient when they arrive. Got it. Great. Sarah.
Yeah, following up on that, does Eugene employ restorative justice programs in order to resolve conflict? So, for example, for shoplifting or disputes between neighbors, and then keep individuals out of the criminal justice system?
Let's ask Mayor Vinis to address that one.
Well, I described our community court
Yeah.
program. So that is really a restorative justice for those sort of minor offenses. And we also do, I mean, we have a drug court, we have other pathways for individuals to follow. So yes, we do use that model.
Okay.
Yeah, so here's a question saying, does CAHOOTS establish ongoing relationships with clients and do follow-up visits, that kind of thing?
Mr. Black.
Yeah, that's a great question. And I actually was just talking with some folks in Oakland right before this, town hall about this same thing. It's tricky, right, with crisis work. If I'm calling CAHOOTS, that's likely because I'm having what's possibly the worst day of my life. Something has gone so profoundly sideways that I need, that support, or I am experiencing just so much overwhelm that I need that outside processor. We on CAHOOTS, abide by this philosophy that it needs to be the individual that's reaching out to us. We need to be getting that almost, affirmative consent in order to engage with somebody. And so part of doing aftercare and follow-up is cold calling, right? That's going out and engaging with a person outside of a situation that they've requested. And for us, we are taking away somebody's ability to consent to treatment if we are initiating the contact through these kind of follow-up appointments. So it can be hard for us to really kind of track specific cases unless that individual calls us back. And really, if somebody needs to call us back every other Thursday night for the next 9 months, great. They're reaching out to us because there's something that's going on. It's going to take a while to resolve, and we can be part of that support for them. So, we don't shy away from, repeat callers because there's still something going on that we can do. We do have a lot of success with CAHOOTS being that primary point of contact for other Whitebird services. So, Whitebird Clinic is a federally qualified health center. We have a medical and dental clinic. We do behavioral health care. We have outpatient substance abuse treatment, and we have case management and, all sorts of systems benefit services. So what we can do is I talk to you at 4 a.m. under a bridge. I'm going to give you a card and, maybe that won't get soggy, but I've made that connection with you and you said, hey, I really need help getting signed up with Medicaid. Okay, I can't do that for you tonight, but we do have this incredible, set of benefits assisters that can help you with that enrollment. They also happen to be part of the case management program. So I can check in with case management and ask, the next time you're doing outreach and you're going around to the camps, can you pop into the one at 7 in Washington and talk to Jay? Because Jay's really got some questions about what they can do to get enrolled with the Oregon Health Plan. And we can get the ball rolling in that way. Our medical clinic does a really great job of building relationships and working with folks who are, unhoused or housing insecure, underinsured or uninsured. So while it might not be CAHOOTS that can do that aftercare, there are still a lot of resources, the Whitebird Clinic, to really support folks for, years.
This next question.
And really quick follow-up, I know we've got other questions, but so CAHOOTS would go around even on non-emergency calls, like looking into an encampment and seeing if something was needed, or just keep in mind?
We respond to anybody in our service area that's calling for us. Okay. I was asked earlier by some folks in Oakland, what's your age range? And it's, from the moment you start taking breath until probably a few hours after you quit breathing. CAHOOTS is there for everybody, regardless of where you are in your lifespan and, regardless of what or where you call home.
Thank you. Great. Sarah.
I think, well, what you just said, Tim, talking about kind of the connections that you make. This person asks, what are some of the referrals that CAHOOTS makes? So they ask specifically, what about the infrastructure that's available? Clinics or housing, shelters, case managers, showers, mailboxes, pharmacies, food, clothing, job training, counseling. That's it.
Right.
We've got smart residents in there.
Absolutely.
Yeah. Good questions, everyone.
I mean, the referrals depend on what's going on for you. Maybe it's that maybe you got that full referral list of all of the different providers in Lane County, and oh man, is it going to be overwhelming to call 50 people and leave voicemails. So maybe our resource referral for that individual is really going through and saying, All right, so I had an in-service, and that provider was at this training, and I know that they have an emphasis in, you know, kind of LGBTQI, you know, outpatient counseling, and you know, you're talking a lot about how your folks haven't been accepting of your queer identity. So maybe this is the provider that you should start with. You know, kind of at a base level, though, looking at what's in our community, we are constantly referring people to the mission, you know, or other shelter resources. We are driving people to the shelter, you know, driving people to the places we're referring for basic needs, showers, laundry. You know, we have, you know, this kind of understanding that everywhere in our community, every service is staffed by past, current, or future CAHOOT staff. You know, and that just really speaks to the level of relationship building that we engage in, so that when I'm making that referral on a shift, I can tell you the first name of the person that's going to be picking up the phone when you know, call in for that intake. And we can talk to you about what you can expect to experience when you show up at that location. So, you know, we refer everywhere, but when we're doing that, we really make sure that we're providing information that empowers our patients to, you know, make their own decisions and be informed when they access.
And CAHOOTS, you're out there 24/7. Is that correct?
Yeah,
Every day?
yeah. All day, all night, every day of the week. Yeah.
Yeah. And maybe Mayor Vinis, I think there's a second van that maybe is getting funding for some additional hours, or?
Yeah, there's a second van that wasn't a full 24 hours, and we added funding. So it's going to sort of happening over a 2-year span. The additional hours came, part of them they were able to staff the first year, and then we've rolled it over into this new fiscal year. So yeah.
So great. And Sarah? Yeah.
So a couple of budget questions. One, somebody asked why the program's funded through the police department instead of through public health. And they wanted to know if the city couldn't fund it directly instead of leaving it to the discretion of the police department to allocate funds from its budget. And then a separate question that's related has just asked that, has the CAHOOTS program reduced the budgets of the police and fire departments because of the services that they've been providing?
Okay, I'll jump into that one.
Yeah.
So, the first question is, this is part of the police budget, and it can't be part of public health because the city of Eugene doesn't have a Department of Public Health. That is a county function, so we don't have that option. The second thing is, and it's a partnership with the police, so they have been the appropriate entities to kind of navigate how that works through the 911 system, just all of the partnerships that Tim has described. That's a very important piece. I think the question about, I mean, there's no question that this saves resources for the city of Eugene because it's so much more effective. It's so much more appropriate level of response. I think going forward, as we have these conversations, the question will be, if we staged out over a number of years a gradual expansion in CAHOOTS capacity to respond, would there be a commensurate kind of savings in the overall police budget? Or is this additional funding that we're going to spend? And I think that I don't have the answer to that. I think that's part of our deliberations over the coming year.
And probably also if you get that payroll tax, or when the payroll tax is up and running, right?
Yeah, I mean, so, we're in this very, I used to have a colleague that referred to this as the messy middle. We're in the messy middle of this conversation because we were on a certain pathway around our community safety system with this community safety initiative, with an understanding that we were underinvested in our overall community safety system and our assessment of what we thought we needed to do. Now we are facing, a very worthy demand that we should divert more resources, that we should allocate more specifically to the CAHOOTS program. And so we have to do that recalibration because we didn't step into that community safety initiative and that payroll tax lightly or without doing our homework about our system and where we thought our system was failing. And so now the system is still failing. And it's not just failing people who are unhoused, and it's not just failing people who are in crisis, and it's not just failing people of color, it's failing the community. And so we really do want to look at that whole system. So I think these are going to be calibrated changes. We won't pull the plug all at once. We'll we'll,
Calibrated changes.
CAHOOTS does the capacity building. They need to do, other providers do the capacity building. They do, and we develop the sustainable revenue streams to support it all at the city level.
Thank you. Good answers.
Here's
Yes,
somebody
Sarah.
that asks, what may happen in the event that the police are called on someone that really should have been directed to CAHOOTS? Does that conflict with the patient's consent to care?
Yeah.
Yeah, Mr. Black.
Yeah. Yeah, sure. There are still, situations where officers are being dispatched to calls that should be going to CAHOOTS. The same thing is true of fire department as well. Some of that is informed by how calls come in. We see maybe a community member who has a bias against somebody who's unhoused might be calling in, describing the situation in a way to get the kind of response that they want to see, not what is therapeutic and appropriate for the individual. When those other public safety entities are going out on responses that are ultimately about CAHOOTS response, they are more than eager to get on the radio and say, hey, we need the CAHOOTS team to come and take this over. And what we're seeing is officers saying, look, it looks like you're having a really hard time, and I'd love to talk with you about it, but we've got the experts on the way. It really seems like you would be more comfortable talking with them. And so we have, it's really because we are part of that public safety system that we can so seamlessly take over those calls. Another important point that I'd like to bring up on that is that, we do wear police radios, right? We are dispatched on the same priority channels as law enforcement, but we're civilian first responders. And that means that there is this group of civilians that are in that system that are hearing the calls, right? That are hearing officers go out on these responses. And when we hear a dispatch maybe for that individual in the on the corner of 7th and Washington, and I'm using that because Mayor Vinis knows that's a corner.
That's
Yeah.
You get a lot of calls
So
there.
when
Okay.
that call comes in for somebody who appears disoriented but is not in traffic at 7 in Washington, and we hear 2 downtown patrol units going, we can get on the radio and say, hey, we are we're grabbing coffee down the street. Why don't you have those officers hang back? We'll go down, we'll check out what's going on at 7 in Washington, and then we will tell you whether or not this needs law enforcement to respond.
Wow. And does really quickly, does CAHOOTS do any joint training with the police department?
We are looking for more ways to have joint training opportunities. For us, it's really provides some potential for recruits for the police department to learn a lot about empathy and compassionate communication and some foundational crisis de-escalation skills before they get to academy and before they start their field training. And we've even Chief Skinner has really asked enthusiastically about how we can make that happen. But what we do right now is that CAHOOTS staff and at least one officer with Eugene Police Department have facilitated joint mental health first aid courses for the community and for police officers.
Wow.
We also have represented from CAHOOTS that are in the Eugene CIT courses. So that's, crisis negotiation, SWAT, all of that, where we are going in and providing lecture on, common mental health diagnoses, common mental health presentations, but also on how we approach de-escalation, what compassionate communication means for us. And then we follow up all of that talking by watching videos of interactions with law enforcement that have not gone well. And we ask these officers in that training to really describe, based on the CAHOOTS approach that we've just trained you on, how could this situation have been approached in a different way that could have resulted in a less violent outcome, or which could have resulted in a situation that did not end in custody.
Wow. Wow. And that training is provided, that's what you do with the police, or you said there was training for the community too?
So yeah, so we do so much.
That's another conversation.
Yeah,
okay.
but specific to law enforcement, there's the mental health first aid courses that are accessible to the public, and it's just that there's one officer in Eugene that has really made it his mission to incorporate as much mental health training into his experience as an officer as he can. And he gets a little bit of a boost from another Eugene police officer who was a CAHOOTS staff member for 15 years before they went to work for the police department. But I think what's more important to that question that Sarah asked is about what do we do to train officers, and that's that role that we have in the CIT courses in our area, but also our ability to interact with those officers when they are in their field training. because they're going to be going out and they're saying, I don't know what to do with their field training officer. And that FTO is going to say, let's call CAHOOTS and watch what happens.
Wow.
And then they get to see that firsthand experience of watching CAHOOTS work with somebody, you know, identifying shelter resources and triaging through all sorts of different unmet needs to figure out what we can do to support that person that night.
It's amazing. Okay, I know we're running short on time. Speed
well,
talk us through this, Sarah.
we have one easy quick question and then one more one longer question. So the quick question is, for the community safety study that you referenced earlier, with whom did you contract with to conduct the study?
You know, that was primarily an internal study. We did have, I'll have to look back at my notes. So we had initially we had an interim between our two police chiefs, and that police director actually was a good statistician. So he did a lot of the kind of number crunching around his data. We did have, so you know what, I don't think we had an external consultant devise that community safety initiative, although we may have had some consultations with others. We didn't bring someone external on board to do that study. It was our own police department and our executive team with some referral to others. So it was, you know, the big gift to us was really in the interim that we had this director who was just, it was his thing. And so he was able to jumpstart it for us. And because he was temporary, he didn't have an axe to grind in what those answers were or where that was going. He was a neutral expert who could look through it. So we sort of benefited just from the fact that we were in between and we had someone who had the skills to kind of look through it and get us started on that process. It's incredibly valuable.
I was going to say, and we will stay in touch because I would like to learn more about the study, and maybe it could even be shared with our police department or our executive team at City Hall. But thanks. Okay, and
last question. In Alameda, we had an incident where a lady called the police on a Black man who they believed was having mental health issues. The man was just exercising, but the police ended up coming and escalating the situation, which resulted in the police using unnecessary force. Does CAHOOTS respond to calls that are made by anyone else other than an individual requesting services for themselves? And could that lady who called the cops in Alameda have called CAHOOTS instead of the cops to request a wellness check?
So that is the exact reason why when we started this whole thing, you know, in '89, that we wanted to be part of that larger public safety system. When you have a crisis line, chances are it's going to be almost entirely first party callers, right? I'm calling because I'm in crisis. People, you know, see something in the community that threatens their personal sense of, you know, safety or, you know, their perceptions of what their community is, and are more apt to reach out and call 911 or call the police, right? And so that, you know, as Mayor Ashcraft, you mentioned that incident of, you know, police contact for dancing while Black. In Eugene, in Springfield, we receive plenty of third-party calls for that. I'm worried about that person, you know, or I'm seeing these things that indicate that, you know, I perceive CAHOOTS to be a necessary resource for that individual, right? And we have a lot of value because in those situations where, you know, you're driving down the street and you see that person who you perceive to be experiencing a mental health crisis, you can call and ask for somebody who's not officers to go out and engage in a welfare check. It's hard for me to really speculate specifically on how CAHOOTS would have responded differently because, as I mentioned, a lot of it depends on, for those third-party calls, depends on how the information is presented. And so if that person is really trying to get a specific response, you know, I think of that incident, you know, I think it was last month in Central Park where, you know, there was the bird watcher.
Bird watcher, yeah.
Right. And he said, please call the you know, please call the cops, you know, like there's nothing wrong going on here. And she said, you won't like what I tell them. You know, and so there is that component that we certainly need to be aware of and be mindful in how we talk about, you know, CAHOOTS as a resource within that public safety system. But, you know, generally speaking, for that person who's on the street corner dancing, yeah, CAHOOTS is going to be who our public safety system would like to send for the first response.
And I think people may know this, but just confirm, if you would, your workers, your crisis workers don't carry any form of weapon. Is that correct?
No, we are unarmed. You know, we don't carry pepper spray or a taser. We don't wear vests or anything like that. You know, the things that keep us safe are our ability to talk to folks. You know, the fact that we have a service that's voluntary, and then as a last resort, that lifeline of that radio that we have on our shoulder.
And I think I read somewhere too, I've been reading up on you, that over the years, you have never had a crisis worker, is it hospitalized for an injury or?
We've never had, I mean, there have been plenty of dust ups, of course. You know, our mission is to work with folks who are oppressed, you know, day in and day out. And with that oppression can come some, you know, responses. And I personally completely understand if somebody's having a real bad day, and they've been treated poorly by every other institution they've encountered in their 50 years. Yeah, you know, maybe they're gonna come at me a little aggressive before they recognize that, you know, we're there for something different, you know, in our response. But no, we've never had a staff member, you know, seriously injured as a result of patient contact or even from a car accident. You know, we've had, you know, maybe a dozen fender benders in the 31 years, you know, and it's all about that training, you know, it's really all, and that situational awareness that has to be part of the job.
Well, I want to thank you both so much. This program and hearing you describe it is certainly as remarkable as I thought it was when I first heard about it on NPR. And I really am just so grateful that, well, Mayor Vinis and I were talking yesterday about how no one really understands what a mayor's job is like except another mayor. But what I'm so grateful to the mayors of Alameda County, where our city is, we're working together and trying to problem solve together. But I so appreciate reaching across state lines to, into Eugene, Oregon, and getting to know Mayor Vinis and what the issues you're trying to work on, and the CAHOOTS program, Tim Black. It just sounds amazing. You sound pretty amazing yourself, and thank you so much. I know that the listeners, our viewers, got a lot of value from this, and Chief Skinner, if you were out there, thank you for listening in. If you want to raise your hand or something, but thank you so much for sharing your knowledge, your experience, your wisdom. We will be in touch. So take care, stay safe.
Thank you so much. Thanks for the invitation. Thank you.
I'm so glad you accepted. Thank you so much. And Tim, any last words?
No, I just, thank you so much. We're really excited, to work with you, Mayor Ashcraft, and the city of Alameda, and really, the whole Bay Area right now has some tremendous potential with what's happening in Oakland, what you all are considering right now, and even some of the things that I've heard, as far as commitments coming out of the mayor's office in San Francisco. So this is it's just so exciting to see everything that's going on in your area, and we're really grateful on CAHOOTS to be able to come to the table and help you all learn from our lessons over the last 30 years.
Well, thank you so much. We are honored by your presence and so grateful for all the wisdom you imparted. So thank you. And residents, have a great weekend. Do everything you're supposed to. Wear those masks. Stay 6 feet away. But have a good time. Thank you all. Great to see you. Lovely talking to you. Bye-bye.
Bye.
Bye.